Hi, my name is Jamie Corsa, and today I'm going to be demonstrating IV bolus push as well as large solution IV medication. So right now I am in my medication room. I have my provider's orders as well as my MAR, and I've done my first medication check, making sure that it's the right patient, date of birth, allergies, and the right medications have matched up with each other. So I am now going to perform hand hygiene and don gloves. So now that I have performed my first medication check, I'm going to go ahead and go into the Fixus and pull my meds. Okay, so first I'm just going to make sure, here I have my 0.9% sodium chloride. It's 250 milliliters, and that is matching up with my MAR as well as my healthcare provider orders, 0.9 normal saline. And I'm just checking the bag, making sure that there are no floating particles, expiration date looks good, and there's no leaking. So now I'm going to take my potassium chloride. It is 20 milliequivalents, and I'm going to put 20 milliequivalents chloride right here. Expiration looks good. I've done my dimensional analysis, and I'll actually be injecting 10 milliliters of this into the normal saline. Here I have my morphine, and it is 10 milligrams per milliliter. I've also done my dimensional analysis, so I will be doing 0.4 milliliters, and expiration date looks good. So I'm going to go ahead and start prepping my meds. So first I'm going to go take an alcohol swab and make sure I'm wiping the top of the vial for 10 seconds. For purpose of the video, I'm not doing 10 seconds. So I'm then going to take my 10 milliliter syringe. I'm going to take my needle here, take the cap off, and I'm going to pull back 10 milliliters of air. I'm going to inject my air. Flip over. Get my 10 milliliters potassium chloride. I'm going to go a little over just so I have a little bit of room to make sure I don't have any air bubbles. Okay. A little bit there. So I have my 10 milliliters of my potassium chloride. Scoop, make sure I'm scooping. I'm going to take this and I'm going to wipe my sodium chloride bag right here down so I can insert the needle. Okay. So I'm now going to insert the needle there. Ooh. And I'm going to inject my 10 milliliters of potassium chloride. Okay. After I have done that, I'm going to take this and put this directly into the sharps. So now I'm going to take my bag and I'm going to invert it, making sure to mix the medications, but I don't want to shake it. And after I have done that, I'm going to go ahead and I'm going to turn it over and I'm going to label, making sure that this matches up with my MAR and my healthcare providers, the right patients. And then I'm going to take my potassium chloride label that I have inserted into the bag and put it right there as well. I'm going to make sure I take this into the room with me so I can scan it as well. Now I'm going to go ahead and perform my morphine, or prep my morphine. So I'm going to go ahead and cleanse the bottle again, 10 seconds. seconds. Okay. Okay. And I'm going to make sure that I pull 0.40 of air. Okay. Going to flip it. I'm going to go down a little farther, making sure that I can get my air bubbles out. Okay, I am then going to have a second nurse verify that this is 0.4 milliliters of morphine.
And I verify.
Okay. So now I'm going to go ahead and I'm going to take my 1 milliliter of saline solution that I have to dilute it with. And be careful not to overshoot it. Make sure you don't want any air bubbles because you can't push any medication out because then you would be under medicating the patient. 1.4 milliliters. Again, I just want to double check. That is 1.4 milliliters.
Yes, it is.
Okay. So, there we go. I'm putting this needle into the sharps and I'm going to go ahead and I am going to put this blue cap on. Since I am taking it into the patient's room and that it doesn't have a needle. Okay, so I now have my morphine needle and I'm going to go ahead and label it. Making sure that I document the client, the medication amounts, and dates. I'm going to make sure I take this in as well because I need to scan it. So I am now ready to take my medication to my patient. I have taken off my gloves and performed hand hygiene. I am now going to go to the patient's room. Knocking on the door and providing privacy. Hello Shirley, how are you? Good. Okay, so today the doctor ordered some morphine because he said you were having some pain. You are, okay. So I'm just going to verify, make sure that this matches up with your wristband. If you could just verify, Shirley Coast, date of birth, 4/3/87, and you're allergic to codeine. Okay, so everything matches up. So now what I'm going to go ahead and do is I am going to start administering the medications. So, but first I want to take an alcohol swab and wipe this because it has been with air. And I'm going to take a flush. And before I flush it, I want to go ahead and draw back, making sure I see a little bit of blood return. And when I do, I can make sure I am flushing it while making sure there's no infiltration looking. And there isn't, so that means that it is patent. Okay. And I'm again going to take the swab and swab it again. And I'm going to take my morphine, just double checking that this is the 0.4 milliliters of morphine mixed with 1 milliliter of saline. And I'm going to go ahead and administer this, and while I'm administering, this should be being administered for the time about 2 minutes. You don't want to go too fast or too slow. Purpose of the video, I'm not doing 2 minutes. Making sure this is going into the sharps container because it did contain morphine. Okay, I'm going to take another alcohol swab and I want to make sure that I am cleaning again for 10 seconds. And we're going to flush the medication through the line all the way. We want to make sure the patient is getting all of it so we are not under medicating. Okay. Perfect. So while that is taking time to kind of kick in, I'm going to go ahead and I'm going to prep my IV on. Okay. What I'm going to do here is I'm just going to make sure again I have my 0.9% normal saline with my 10 milliliters of potassium chloride. Everything's good. Okay. And I want to make sure that this end does not touch the ground. We need this end to stay clean, okay? Go ahead and puncture the back here. Make sure I am priming my drip chamber halfway here. To open this. And we want to fill Minnesota, and then we want to move it back over. And making sure it's primed. And getting all the air bubbles out. Once the air bubbles are out, I'm going to go ahead and close my cassette to stop that. And I'm going to enter my cassette here. There we go. Okay. I'm going to take my alcohol swab. And I want to make sure I'm cleaning this before I connect the line to the patient's IV. Okay, and then I'm going to take my IV tubing label, make sure that I am labeling the date and by who and what time it is. I'm going to go ahead and just put it right there. Then I'm going to go ahead and set my normal saline for 125 milliliters per hour, and that will be for 2 hours. Okay. So now I'm going to go ahead and I'm going to ask Shirley if she needed anything. And she said no, so I'm going to take off my gloves, perform hand hygiene, and I'm going to make sure that I go ahead and I go dispose of this with a second nurse, verifying that it is disposed. So it's been the 2 hours and the machine is beeping saying that it is done, so I'm going to go ahead and go in and I'm going to disconnect. So knocking on the door, providing privacy. And just, hi Shirley, how are you? Good, okay, so your IV has stopped, so I'm gonna go ahead and discontinue that right now, because it's been the 2 hours, okay? Okay, but first I'm gonna go ahead and I'm gonna verify your name and date of birth. Shirley Cass, date of birth. Okay. I'm allergic to coding, so what I'm gonna do here, I've stopped my medications. I'm going to go ahead and take this off. And I am going to put the blue cap on, so this makes sure that it stays clean. So if we have to use it later, we still can, and the doctor can order more if they need to. So I'm going to hang that right there. Again, Shirley, I'm gonna go ahead and just, this has to stay in, just in case the doctor, prescribes you more medications, okay? So I'm gonna go ahead and just take a alcohol wipe here. I'm gonna wipe for 10 seconds. And I'm gonna go ahead and flush again because we want to make sure all the medication is going into the patient. Okay. That is good. Okay, Shirley, is there anything else you need from me? I'm gonna go ahead and come check on you later. Okay, there isn't, so I will then take off my gloves again, perform hand hygiene, and I will then go out and document the medication given, route, date and time, milliliters per hour, and also other medications. If any of them are refused, I would also mention those. And start and end time, and as well as any other documentation that I need to do. And that is it.